My name is Lindsay Furkovich-Nelson. I'm VP of Sales and Marketing at OneSource, and we'd like to welcome you to the third webinar in our Speakers Bureau series, brought to you by OneSource and David Jagrossi. Today we have Reprocessing presenting device reprocessing during the COVID-19 pandemic, know and reduce the risks. I would also like to mention the COVID-19 database OneSource is hosting, which contains vital equipment and news, which is free for subscribers and non-subscribers, available on onesourcedocs.com. And please reach out to us if you need any assistance accessing that. Now I would like to turn it over to Weva. Thank you.
Thank you so much. And thank you for OneSource hosting this Speakers Bureau webinar series. I'm the third time that this has occurred, and I am Weva Truscott. Welcome to this world. And again, let's see, we're having problems. There we go. I'd like to thank OneSource for sponsoring the presentation. They're actually celebrating 11 years now of changing the face of patient safety with the latest IFUs and PMs, documents on demand. As we go into our talk today, we're going to talk about reprocessing during the COVID-19 pandemic so that we can know more about the risks and reduce those risks and what this bug is all about. And on our objectives, we're going to talk about who's most at risk for having COVID and why, what situations increase staff risk of contamination and the virus in SPD, how long it takes for the virus to live on different surfaces, and what can we do to reduce the coronavirus spread at work, at home, and at the grocery store. Now, it's always important to know our enemies. So first of all, let's understand what's been happening with this particular type of virus. We call it SARS, and that's an acronym, and it stands for Severe Acute Respiratory Syndrome. And over the last 20 years, 3 coronaviruses have leapt from animals and started to cause human SARS. The first one, in SARS-1, was in 2002 from the civet cat, and we remember the terrible times for SARS in Canada and other places where healthcare workers acquired a lot of the SARS infections. And then the second is the SARS-MERS, and that's the Middle East respiratory syndrome, which was very severe in the Middle East. And in 2012, it came from the camels into humans. The third one was the SARS coronavirus 2-2 from bats and pangolins, that darling little animal you see on the right, which is actually used in Chinese medicine, but is also a pet to some and is related to the anteater. Looking at this virus, first of all, I want to look back at things we know, like the Pseudomonas. Look how big Pseudomonas is up there in the red. Pseudomonas is about 5,000 nanometers in length, a good measurement that microbiologists often use. In the purple one to the right, we see Staphylococcus, which is about 1,000 nanometers. And both of these you can see quite readily in a microscope. Same with bacteria, mold, and spores. But viruses are so small, it takes that electron microscope that you see on the left. When I was training ages ago, it took almost a whole room to have one electron microscope. But the coronavirus, then, to see it, it's 125 nanometers in diameter, so much, much, much smaller. Now, how did this enemy get its name? Well, it was not from the corona beer. Many believe that perhaps it is from the corona of a sun when it's in an eclipse, and you can see it looks much like that on the outside with those little proteins forming. Also, what's called, thought to have been the reason, it's a crown. And you can see the crown there. Now, how does it get into the lung cells? And those little crown pieces are very important in this. It enters through the nose, the mouth, and inhalation, the eyes as it drips down into the oropharynx and can be inhaled there. Its protein spikes attached to receptors on the lung cells, and these receptors are called ACE2 receptors. They fit into that receptor like a lock. It actually, as you see in the left picture at the bottom, that lock, as it it touches the lung cell, which is at the very bottom of the page, it will open it as a door. And in the middle picture then, it shows that it is emptying its DNA genetic information. And it's not DNA, it's RNA. And that, even in our human cells, we have RNA, and they're the reader. After you have DNA, it takes an RNA to read it, and then it takes it over to little things that we've got in all of our cells, and that's the ribosomes. The ribosomes are taking that RNA, the red line that you've got through the ribosome, it's reading that RNA and making then those virus proteins that you see coming out the tail end. So those are instructions on how to make viruses. And the entire cell now, that's all it's allowed to do is make viruses. On the far right, you see an artistic drawing of a very perfect coronavirus. Now that the viral envelope components are composed in the cell body, and they come together, and then they are pushed out of the cell. As you can see in this picture, the bottom part would have been the lung cell, and it's pushing out now those viruses that they've assembled together and are now being pushed into the alveoli of the lung. This is a good picture of that happening. You can see the little green circles around the interior, and that's what's nice about an electron microscope. You can make it identify certain proteins, and this is identifying the coronavirus protein. So one cell now is going to start pushing out all these viruses, and you can have hundreds and even thousands of viruses being pushed out by a single cell in your lungs when it starts going. Now, once it does, what happens when you get things starting to come out? You want to cough. And so here we have a great illustration of a cough transmitted primarily by these droplets. And inside the droplets, you don't know which ones. It can have one virus, it can have many viruses, it can have no viruses. We don't know yet. So the cough is being spewed forth, and normally it will drop in about 3 to 6 feet. The droplets will. And it would then have the viruses in it. So I have a little bit of problem with my advancing here. If the conditions support it, the droplet can dry to very thin film covering rather than the heaviness. And it will dry out, and if it dries before it hits the ground, then it's light enough that the air currents can carry it. And research has shown that it is possible with the coronavirus. It's usually about 10 to 12 feet, so it's not very far, and it's usually already coming down because it's drying. And so they really believe that the primary way is by these larger droplets. You can see why you want to wear a mask and not get if you can stop the larger droplets from getting through to your breathing portion, you can stop the virus from coming in. So that's why social distancing, one of the reasons, it is very, very important. And here is an estimate of what the difference is. If you can, and standingly obeying those rules is just so important. Here we have in 14 days, when you're observing the social distancing, 128 million infections in this particular epidemiological study. However, if instead of 14 days you do it for 2 months, you'll have 14 million total infections. Look at that difference. And how many things can we come up with, like new identifiers for the disease or new treatments in that time to hopefully to help those that even do get sick so that it's less severe. And now, how does it really cause the disease? Well, each of those lung cells, each lung rather, has about 480 million alveoli, and that's the picture you see on your lower left. They expand like balloons every time you breathe. 480 million in each lung. It's just amazing. And when you do, the oxygen that you take in from breathing goes through the thin little membrane that makes up that balloon, if you will. And on the outside of that, you see the blue and the red. Those are capillaries. They're just letting soldiers of the red blood cells come through one at a time, single file, and they pick up the oxygen that's coming through that very thin membrane. At the same time, they go ahead and then it turns red, so you can see the difference between oxygenated and non-oxygenated. At the same time, they are releasing CO2, carbon dioxide, into the lungs, which is then breathed out when you exhale. Let's see. Having problems with advancing a bit. I apologize. There we go. When the CoV-2 attaches to that lung alveoli that we talked about, it forces that cell, breaks into the cell. And just like if you have an infection on your finger, it swells. And so the membrane that we were talking about is so thin, it thickens in that swelling. It reduces the lung capacity to pass the oxygen out to the capillaries and to take in the CO2. As time goes on and that becomes more of them become infected, and you have an increase in your inflammation, that gets thicker and thicker, and so finally you're not really passing that oxygen into the capillaries at all, and the body begins to suffocate. At that point, unfortunately, you can have the patient may drown or suffocate from lack of oxygen. There have been fluids that have come in to help with the inflammatory response, and that actually causes more of a drowning effect. And alternatively, some people will go ahead and kind of recover from that, but it opens them up to secondary bacterial infections, which can also cause death. Now, what about those that survive? Well, the nice thing is about 80% of those who become infected really have mild symptoms and minimum to no long-term effects. So we need to keep that in perspective. But about 16 to 20% of those that are symptomatic and who eventually end up on a respirator and intensive care units, they can, and if they recover, those that recover can have lung fibrosis, which is basically scarring. It can be a thickened alveoli, again, that we're talking, having a hard time processing that oxygen, adhesions that limit the lung expansion. They require long-term supplemental oxygen, develop heart damage, up to 20% of those recovering after the ICU, blood clots, and they can actually, those clots can get stuck in the lungs, so you have a pulmonary embolism, or in the brain where you could have a stroke. You have impaired liver function, kidney damage, and neurological malfunctions are being noted in some of those survivors at this time. Now, what determines those who become that seriously ill? Well, there are a number of things that go into it. It's the number of particles that you breathe in. In other words, you have a large dose. Perhaps they believe that might affect that problem. Genetics, in some cases, we don't know about this virus yet or not. It can be related to genetic conditions. The route that it enters the body, the virulence of the virus, how violent it is when it attacks. In some cases, especially with something like coronavirus, you can have mutations where some can be more virulent strain than another. And then the infection history. Have you had the disease before? Have you had the coronavirus before? You may have some level of resistance or complete resistance, other illnesses that the patient may have, and age. As you see in the picture to the lower right, 53% of those who enter the infection control unit are actually those that are over the age of 65. So age in this particular coronavirus disease is making a huge difference in the severity. And why is it so severe in the elderly? Their immune response is much less effective, so they can't fight it as much. Their tracheal cilia, which are like a conveyor belt that come from your bronchi in your lungs, they help to pull up the viruses and the bacteria and the particulates that may enter the lung. So you're constantly kind of having them coming up their throat and do a little bit of a cough and can expire it or even swallow it. But for elderly, it slows by about 50%. So a lot of things can get through and get into the lungs, deeper into the lungs. Deeper usually means more serious infections. Malnutrition, they often aren't eating enough protein, enough calories to fight the infection. Frailty, weakness. Organ transplants, if you've had an organ transplant, you have anti-rejection drugs, which keeps your immune system down. The severity increases with underlying diseases. So if they have diabetes, heart disease, high blood pressure, kidney disease, chronic lung disease, such as asthma, smoker's lung, COPD, and cancer undergoing treatment, all of these would have increased risk to have the more severe reactions to the infection. Now, how do you know if you're infected? This is very much like, many of the symptoms are like the common cold, the flu, and allergies. But it's most like, you get it confused most easily with the common flu, which we've had plenty of this last year. And sorry, there are problems with my advancing here. But look at, see, common with the fever and the dry cough, the headaches, the aches and pains, and sore throat. That could be either one. But when you look at the shortness of breath, in order, and that is because you're not getting that oxygen through to your blood vessels, so the body's trying to make it up by breathing really rapidly. That's something that doesn't happen in the flu. And then also this loss of smell and taste, which we're seeing quite a bit of, and sometimes can last for quite a long time, is not always present in the COVID, but it usually is, or often is, I should say, and it's never exists in the flu. Now, although there are many different shapes of and sizes of viruses, this really breaks down into two types, which is an enveloped and non-enveloped. Remember, I talked about that envelope earlier. And as we look at the, okay, here we have on the left the envelope virus, and you can see that we have coronavirus, and influenza is also one of these envelope viruses. The benefits are it readily mutates to adapt. The weaknesses are it's easily killed and becomes harmless. We use the word killed, as viruses aren't considered alive, but killed is much easier to say than rendered harmless. So I'm going to say that often, probably. It's vulnerable to the environment situations as well, where the non-enveloped, like norovirus or poliovirus, its benefits, it's very hard to kill, and it survives wide ranges of environmental conditions, but it doesn't mutate very easily. So we already know we have mutations as the eventual problems, as we saw in those three types of SARS that have happened over the last 20 years. Okay, and here, this is a good electron microscope picture. At the bottom, you see the envelope around the enveloped virus, and up above the picture of a non-enveloped virus. Now, this is an important slide because it helps to show us how how much harder it is to kill. Sorry, you should close your eyes, I hope, because I want to show that in a minute. It's harder to kill as you move up that arrow. Very easy to kill the envelope viruses, much harder for the non-envelope, and of course you see the spores there up at the top. Now, how easy is it to kill? Look at that. Soaps and detergents will kill the envelope viruses. But because of that, all the things that will kill the other things will also kill it, whether it's your quats, your alcohols, and no, that didn't mean drinking it. The phenols, the quats, alcohol blends, the aldehydes, the hydrogen peroxide or the bleach hypochlorite, and the peracetic acid. And those will all kill that envelope, as you can see. The envelope viruses, and once you rupture that envelope, it can't affect anything. Now, even though all of these are effective, we have to remember to always follow the instructions for use, the IFUs, to avoid damaging the device, voiding the warranty for the device, and preventing the associated patient injuries that could occur and the liability that could cause our facilities and potentially ourselves. Now, we said soaps work. Well, soaps and detergents work. Detergents are the same as soaps. It's just a synthetic variety, except they don't have the lingering film that soaps have on it. But either way, it's the same mechanism. You see the red little things on the upper left, and we explained those before. That's that key that's going to get into the lock of the lungs. The yellow arrows are pointing to the envelope that's around the artistic drawing of the virus. On the right-hand side, you see the soap and detergent molecules, and they all look the same, either one that they are, and they have two ends to them. And on the left bottom picture, you see that they puncture the envelope, and with it, it releases those little keys, and the keys cannot be reassembled. Then over on the right-hand picture at the bottom, you see that the soap molecules or the detergent molecules will surround the protein and then the parts of the envelope, and they make it easier then as you rinse the product or your hands to just go down harmlessly down into the sewage system. So it's a very awesome looking effect that it has. Now, how long can things stay alive on surfaces? Well, metals generally about 3 to 7 days. And now at the end of this talk, you're going to be able to, within a couple of days, be able to print the whole program. So you don't have to memorize all these things, and I won't say all of them, but you'll have references to what types of things we're talking about throughout the whole talk. But generally, metals, it's 3 to 7 days. It can still remain effective on the surface. Stainless steel, 3 to 7 days. Copper, less than 4 hours. And that's why you see that popping up in a lot of hospital areas, like the handrails for patients and that sort of thing. Aluminum, my Mountain Dew cans, 2 to 8 hours that it will survive. Natural rubber, less than 8 hours. Wood, 2 to 4 days. Plastic, 3 to 7 days. Glass and ceramics, 4 to 5 days. Cardboard, less than 24 hours, and that's why they've allowed the Postal Service to keep going. Paper, about 3 hours, and that would include, by the way, which I don't have on there, tissue paper that you're blowing your nose with, or sneezing into, coughing into. Tap water, 0. They've said that the municipal water is considered free of the viruses due to the treatment, like we say, easily rupturing that envelope. The cloth is about 2 days. Okay, that's important. Cloth is about 2 days. Mask and respirator out on the surface, especially the inner and the outer, where you're capturing things on the part of the surface, can live for 5 to 7 days or remain effective for that long. So that's extremely important. Feces and urine, 1 to 2 days, and if the patient has diarrhea, about 4 days. Some of the more common agents that you don't think about is heating it. If you can heat it to 56 degrees centigrade or 133 degrees Fahrenheit, if you had called the manufacturer or you've done it before or whatever, in 15 minutes it kills about 10 coronaviruses. Soaps and detergents for hands, alcohol, best is ethanol, but either one will work, the ethanol or the isopropyl. It needs to be 70 to 90%. For hands, they actually say it can be cleared down to 65%. But below that, it's less. It really is not very effective at all. And above that, it's not effective. It ruins its effectiveness. So that's an important point. Detergents, again, for cleaning things. And by the way, when we talked about dish soap, that has just become a common usage. It really is a dish detergent. And you can see that somewhere usually on the label, but that's what it is. It's a detergent, and that's why you're using it. It doesn't leave a film on your dishes. And then you have bleach at a 1 to 10 of your household bleach, which is about 5%. A 1 to 10 is 5 minutes contact time, or 1 to 100 dilution is about 10-minute contact time, and that's a 5% sodium hypochlorite, which again is your household bleach. Note that once diluted, that hypochlorite is only good for 24 hours. So you need to put a date and a time on it, and that's very critical to its effectiveness. But also, a lot of people don't realize you can't use hot water because it decomposes the hypochlorite. It renders it ineffective. The EPA hospital-listed disinfectants are also extremely important, and we'll show you that in just a moment. Just remember that to always use your IFU to make sure that what you're doing is safe. Now, the EPA has done some great things here. I think it's just awesome. They've listed everything that's effective against coronavirus. You see on the left, we have EPA registered number. That is, looking at the lower right, the EPA registered number. The first two sections of that number say this is the type of disinfectant that you have, and this has been cleared. The other three numbers or four numbers that you may see after what I have here on the list are actually unconsequential. They're just different names of the producer of it. But what's so nice about this, it talks about the active ingredients, it talks about the product name and the company, but even more importantly, it talks you what the instructions are, how long it has to be in contact, what the formulation type is, the surface types for use, and the use sites, which means, can I use it in the hospital? Can I use it in my household? Can I use it in food contact? So it's very, very convenient. Remembering all the different surfaces that we are looking at, and they're so different and so critical that we need to make sure we are using the right product. Wipes and rags contain cellulose. So this is another extremely important thing that most people don't realize. Cellulose, which is like paper and cotton, bind the active disinfecting molecules of sodium hypochlorite, of the quartz, of hydrogen peroxide. They decrease active concentrations. I'll show you a couple examples. This is sodium hypochlorite at 500 parts per million chlorine, very often used in the hospitals at that level, and it kills about 100,000 staphylococcus in a specific amount of time. If you put a cotton rag in the bucket for 1 hour, as you see on the lower right, it's only going to kill about 100 Staph aureus were killed in this particular experiment. Or in this experiment where 10 milliliters of saturated 10 milliliters of the hypochlorite, which is almost 700 parts per million in this particular study, they sprayed it onto the paper towel, waited for 30 seconds, and then tested for the active ingredients, the amount of parts per million on the chlorine. And they found the stock solution on the left, and then if you use cellulose, the paper, it was cleared down to almost just 100 in 30 seconds. And then the cellulose with a polypropylene blend, so putting the two together made it much better. Rayon polyester blend better, and a polypropylene, which is almost the same as a stock solution. And that's what you'll find in your canisters, that they're already, because they have to send it to the FDA to prove that it's not going to decrease the active ingredients. It's also what you use for wrapping most of your instruments and things like that. That's a polypropylene blend too, and often your gowns as well. So it's being used a lot. Cellulose paper wiper caused a 75% reduction in disinfection efficiency in this particular study by Schultz. Used in sterile processing are used to decant contamination. You just have to remember that everything you touch could be contaminated, and everything that you touch thereafter could be contaminated, or anything that object is on could be contaminated. It's the same thing with coronavirus. One of the things we sometimes neglect, I think, and they're finding with the coronavirus, is that it can also come on the soles of shoes and be walked out the door. So we need to think about those shoe covers and make sure that we're putting them on and taking them off at the right time. In removing jewelry, let's go through the practice. We need to take that jewelry off, whether it's the rings, the studs, the earrings. Remember, it'll stay alive for up to 7 days on that metal. Never wear face masks like necklaces. The CoV-2 is still infective on the outer surface of the face masks for 5 to 7 days. So just can't do it. And I know how easy it is to not think about it, pull it down, and contaminate your set. And if you contaminate that, think for the area that you're breathing in is going to be coming from that mask. Scrubs should be provided and donned by the facility. Change them daily, more often if they get wet or body fluids. Visibly contaminated scrubs must be laundered in the facility. And then clean shoes to be worn only at work, non-skid, and wear shoe covers. CoV-2 on the floors around the patients, as we talked about, has now been discovered to be an issue. PPE required at all times. Separate that PPE area for decontaminations is separate from the other PPE that they'd be using on the other side of the window. Scrubs laundered by the facilities, we said. The head covers required in central services, and bless you all for wearing them. I know it's a pain in the neck, but I wish that they were being worn throughout the facility. I mean, viruses can live on hair too, although I haven't seen a study that says how long. Fluid-resistant barrier, jumpsuits, aprons with sleeves, and gowns, the fluid-resistant shoe covers, the heavy-duty gloves, and you can wear the thinner inner ones on the inside if desired. Don't use vinyl or polyethylene. It's just not strong enough to withstand your work. Face mask or respirator should be worn, and also a shield or goggles. A shield, of course, if you're doing your decontamination work in the sink areas. Remove the PPE if leaving decon. Reusable gloves. Wash and dry them inside out is permissible. Wash hands in the hand wash sink, not in the utility sink. Exterior surfaces of masks and respirators, like we said, can be contaminated, inhaled, and live a long time. So we need to be very careful when we are putting on or taking off masks, putting on reused masks, or taking off used masks. When we're performing seal checks on N95 respirators, when we are adjusting the fit of any mask or respirator, or removing them, just keep picturing something fluorescent or something that could be splashing to the rest of your face. There are several effective ways to disinfect masks and respirators, but each of them have some limitations. In the upper right is a new thing, and it's really exciting. Battelle and the government are buying these, and that is, and no, I don't have any relationship to them. It's a hydrogen peroxide vapor that can decontaminate in 2.5 hours. 80,000 a day can be processed that way, and there isn't a lingering problem whatsoever of taking them right away after that time is done and putting them on. Dilute bleach and hydrogen peroxide could be used. I like them best in wipes because you kind of watch and get around to all the sites, but you can also spray, but not so heavily. That it takes forever to dry. You really need to leave them overnight so that you don't have that smell of bleach solution. Ultraviolet light, as you can see here, is also effective, but on the folds where you have shadows, it can't necessarily get to. So, like I say, all of them have some little issues. And the top one, of course, is it's just not now coming out, and I'm sure that it'll be expensive. Brushing the instruments should be done under the water. Did I say that out loud? Brushing instruments should be done underneath the water level. You want to prevent any excess splatter or spray. Decontaminate, soak, wash, and rinse before refilling your sinks. Alcohol wipe after disinfection removes a residual disinfectant that some of your products may not be able to handle. Sterile processing, watch outs for accidental sprays. Water spray of your contaminated things before they have been soaked in any soap. You could aerosolize the coronavirus when you're spraying down. Make sure it's deep in the sink. Make sure also that you have used some detergent over it, and keep it down so it's not going to be splashing up at you, and wear that shield. Do not drop dirty items into the sink. It causes a splash. And this is a big one that is not always being followed. Close the lid on the ultrasonic cleaners every second it's running. It does create tiny aerosols that can be inhaled, and it fix it or improvise right now so at least it's covered and or broken or missing until you can get it repaired officially. When pulling out the brush in and out of an endoscope, have you ever thought of it? You know how the brush bristles kind of flip back out? Make sure that it's not anywhere near your face, that you're aiming it away from you, and direct it outwards, especially for your bronchoscopes and your sigmoidoscopes, which may have the coronavirus, or which could have. Do not dry and force air unless absolutely necessary, especially now since we're dealing with something that is catapulted into the air in tiny droplets or in droplets. Then use only after cleaning and disinfecting what could be the CoV-2, rendering it harmless when you're drying. Remove contaminated PPE properly to make sure you're not re-aerosolizing virus. I know you want to get out of there, and and don't throw your gloves like slingshots into the garbage can. No points. Cell phones easily become contaminated in decon. Then you put them up to your face, you touch your areas. After handling, you contaminate clothes and surfaces. You can take them home to kids. The kids pretend playing talk to mom and dad, or they play Angry Birds and become contaminated. Decontaminate them with a disinfectant wipes or with alcohols, but be sure it's okay with the IFU, in this case, with the manufacturer's compatibility. And some have actually put it already on the website. This particular one was on the website. Use only a soft cloth, lint-free cloth. Avoid excess of wiping. Unplug all power sources to the device before you start to disinfect it. Keep free liquids away from the device. Don't soak the device. Don't spray it so that it gets into the little crevices. Don't allow moisture into any of the openings. Avoid the spraying we talked about. Avoid strong bleaches and abrasives. One manufacturer actually recommends the use of the 70% isopropanol alcohol wipes or disinfecting wipes as for their particular phone brand. Dedicated area for storage is very important in decontam. Keep the storage closet interior dry and the contents dry. Don't share them with any of the other departments. Use disposable items for cleaning and disinfection wherever that's possible. General rule, clean from top to bottom, clean to dirty, and you can use the clockwise or counterclockwise method, right or left hand, while you're doing that. The guidelines are less stringent for EVS, as far as you can see that in this case, there's not the cover over the head. They also need to remove the jewelry. They need to wear waterproof shoes, gowns, mask, respirator advised because of the COVID-19. Eye protection, examination gloves or heavier, change the PPE, at least gloves and gowns to prevent contamination between clean and dirty areas of SPD. So this gets a little mixed up because you're going to be dealing with some areas that are just outside. But first of all, we'll continue here. I just got out of my mind a little bit on what was next. Daily frequent house cleaning, at least twice to clean that transfer window. 2 times during the day, frequently touch surfaces and countertops and washing equipment surfaces. And these are more the standard type things that we need to be doing every day anyway. Buttons, dials, handles, and SPD that may be touched and contaminated. Hand washing sinks and faucets, utility sinks before and after use, but also the utensils that you use, such as brushes and touching faucets and faucet handles. Frequently remove intervals of biohazardous wastes. Each bag must be tied by gathering and twisting that neck of the bag and by using a tie-off or a hand knot. I'm not sure that everybody is doing that. Waste management will actually take care of it from there. So there's nothing special. The Department of Transportation says it is a regulated medical device like all the rest of the infections that we could possibly get from a facility, healthcare facility. Confirm EVS is disinfecting elevator buttons because they have found that there are about 40 times higher bacterial counts in toilets, which means that viruses can also be there. Handrails for stairs that SPD may be using, handrails near SPD doors, and what I'm doing is just helping you make extra precautions for your own staff going in and out, as these areas may be contaminated by patients walking or by other individuals who are contaminated. Door handles, auto open pads, push bar doors, all frequently touched. Touch screens, light switches, transport carts, and don't forget the wheels, and whatever else you think could be contaminated. One of the things we don't think about is we handle that cleaner disinfection canisters with the disposable wipes in it. Let's make sure that we wipe the outside of that and the top of that and the bottom of that we may have placed on contaminated areas, or our own hands and gloves may have contaminated. Clean and disinfect all the work areas and high-touch areas, surfaces that we normally would do. Do not dry sweep, mop the floors and clean, use a single mop head and dispose of it, or use a wet vac. No terminal cleaning while the devices are being reprocessed. This is just a good example to put up to remind us. This is easily accessible from the CDC. I like it. They have 2 or 3 examples of how to remove things. This is probably the best, which is example 2, because it includes the goggles or the face shields, which the others don't. It helps you to know what order to take it off and when you should be washing your hands, either with soap and water or alcohol hand sanitizer. Everywhere think, what could be contaminated? Remove your work shoes when you leave the hospital. If you're going in a subway or train, wipe down those areas you're going to touch, hold on to, or sit on. When you're leaving, it's out of courtesy and safety of others. Please also wipe it again. Cover the face as required by your state or city, or take it on yourself, even if your state or city decides you don't have to do it. It is important to protect yourself, and in that way you're also protecting others. Arrive home, shower or bathe might be wise. Think about it. Cough or sneeze into a tissue. I'm going to emphasize this again in case my voice is getting boring. Cough or sneeze into a tissue and place that into a trash. If you don't have trash, or things are going to be dropped in the trash so that you could airlize something, remember it's going to live about 3 hours on that tissue, a plastic bag that you can toss later. Avoid sneezing into cloth if possible. So the elbow thing can be an issue because it's going to be around for 3 hours and you can't just take it off, or usually you can't, and wash it or throw it in the trash. Wear a mask. Now, let's go to the grocery store. Wear a mask or a material to cover the mouth and nose. Wear disposable gloves if you have them. Wipe down the cart and the basket handles with the disinfectant wipes. Stay at least 6 feet away from other people at all times. Assume items have been handled by others and that their hands are contaminated. And maybe they didn't even know they were infected, or they got contaminated from touching something else and are now touching your produce, packaged foods, the cans, the shelves, the freezers, the refrigerator door handles, the credit card machines. All those things could be contaminated. I know it sounds bizarre, but remember we're talking about dose too. And you're constantly in a position that you might be contaminated and adding more and more to that contamination level. Touch just the items you intend to buy. Wash your hands and use hand sanitizer when you're done. When you go home, leave the non-perishable groceries out for 72 hours to deactivate the virus is a method you might want to use. Remember, as you walk in that door, wash your hands, sanitize the surfaces you touched in the car and in the home. But also set up a cleaning station or an area that you're going to use. Wipe down the disposable plastic bags and grocery bags. If you didn't leave them out for 72 hours, now wipe the cans and disinfect with a disinfectant wipe or detergent water, which is what I do. Dump them in the detergent water, move them aside, and let them sit out. Let's see. And then you can wash them later, like my Mountain Dew cans, just for the areas that you might be drinking or opening up from. Vegetables, soak lightly for 20 seconds in water with a mild dish detergent in a basin, not hand soap because that's going to leave a film, and then mildly rub it as you are rinsing it to get the detergent off, but also to remove the carcasses of the viruses, just get rid of everything. And this is something that we really should be doing with our vegetables as well, which I am learning to do better and better. Wash disinfected the surface that were touched by your hands, the groceries, the unwashed bags, the countertops, the light switches, the door handles, the keys, the steering wheel, anything touched that bringing in the groceries, and wash and sanitize your hands. With laundry, wash and sanitize your hands whenever you're touching the potentially contaminated items. Don disposable gloves before you start if they're available. Do not shake your laundry before placing it in the washer. Wash potentially contaminated with the non-contaminated. And they emphasize that several times. The CDC says that is not an issue because of that detergent and the heat we're going to have. It's going to wash them away, and it's not going to cause a problem for your non-contaminated items. Use normal detergent and the warmest water temperature allowed for the items. The fabric softener can be used as it normally would be. That's not a problem. Wash and disinfect your hands after you're done. Dry at the highest temperature recommended by that item being dried. If at a laundry mat, take the clothes home to be folded so that they are not being re-exposed to potentially airborne or something on the surface. And I think that's a really wise recommendation. That's one of the laundromat notes had on it. Wash the hand and sanitize your hands, then go back and disinfect those surfaces too, that dirty clothing or linens placed on them prior to washing, detergents and softener containers, washer, dryer, surface and controls room, light switches. This is a habit because it's a very contagious organism and it's easily killed. Why don't we just go ahead and make sure we kill them before they have a chance to contaminate the rest of our family or ourselves again, and then wash and sanitize your hands again. The end of groceries, laundry, surface disinfection adventure or ordeal. Such precautions, they can help you lower your chance of being exposed to the virus, and in turn your family, colleagues, friends, people you don't know, and stop that link, that weak link of contagion. Please take these inconveniences very seriously. Health and lives depend on being aware of our actions and the actions of others. Don't forget to disinfect the bottles, the push ports, the caps, the disinfectant heads, the dispenser heads rather, of your hand sanitizers and spray disinfectants. They could always be contaminated. The perfect storm. We're being prepared. We're learning how. Very probable we will face a worse epidemic, and I would predict within the next 5 to 15 years. Why? Because all kinds of things are happening now. We have the failing means of treating infections with antibiotic and drug resistance, making it more severe if we do get infected, and more things mutating that could also be then more vicious, which is happening. Mutating, new emerging and returning microbial pathogens, decreasing vaccination acceptance, so it's going to spread faster potentially, declining efficacy of the pathogen diagnostics. It's hard to identify them, the new types of diagnostics that we're going to be needing, an aging, more vulnerable population. 1 in 5 people will be over the age of 65 in 2050. Expanding percentages of patients with drug addictions, making their systems weaker. The more intricate and delicate, more intricate and complex surgeries, which also makes it harder for us to clean and disinfect so many of our endoscopes and other devices, making it harder, more and more possible that individuals could be contaminated and infected that way, whether it's a patient or the worker. The climate change, permafrost thaw, they have recovered now infective viruses from the thawing permafrost that have killed reindeers and in one case a person. So we're going to have things that we haven't been exposed to for centuries and centuries. The increasing natural disasters and disrupting services, the demands for saving healthcare and companies' money, the increasing human population density, rodents, obesity, diabetes, aging utilities, water lines, electric grids, moving back to untreated foods. So often we think of those as healthy, and in many cases they are because they don't have the chemicals, but they also could allow organisms to survive there longer. Non-disposables in clothing, in hospitals, homeless populations, a lack of sanitation, medical care, and good nutrition. All of these things help to bring about this perfect storm, and mutating viruses with envelopes are no help at all. We will make it through this. We must learn and be better prepared for the next one. And I celebrate every one of you as a sterile processing departments. I think you're awesome and you're underpaid. But I don't know what we'd do without you. And I want to say thank you. And please, to receive your 1 credit certificate from OneSource and Isham, please fill out and submit the form at onesourcedocs.com/CE credit 3. That's OneSourceDocs, and that's DOCS.com/CE credit 3. And get a copy of the presentation when that is uploaded as well. And with that, I thank you so much for being patient and listening to my blundering through. And please be safe. Please appreciate the social distancing and all the rules that we need to prevent our own contamination and those of others. Thank you so much. Bye-bye.